Okay, hello everyone. Welcome. Welcome to this webinar. This subject is the take-home Binex testing. So in the spring, we did this test at home. Now we have a self-administered nasal swab, and results are provided within 15 minutes. That was what we did at school. Now we have an option where students can take a test at home, and we're very happy and honored to have two individuals here today that are going to walk us through this. Please feel free to ask any questions. You can type them up in the chat if you have any questions. And then give us a moment so that we can sign those. If you'd rather use your voice, take the moment so that we can spotlight you. If you do want to speak for yourself, I'm sorry. I just realized we're in the webinar format, and so it's a little different. Use the raised hand feature, indicating that you have a question. If you want to speak or sign, give time for Erica to spotlight you, to first promote you, I should say, to a panelist, and then spotlight you. All right, so let's welcome Jackie Cruz, and she works for California Department of Public Health, CDPH. And then we have Laura Barrera Vera from Primary.health. And welcome to the two of you. Thank you.
Hi, everyone. We have a short presentation today.
Sorry, hold on one second. Okay, perfect. Okay, ready when you are.
Okay. Hi, everyone. We have a short presentation today, and we're just going to give a brief overview of the at-home test and the simple steps for doing the test at home and how to upload your results onto Primary.health. So I'm just going to share my screen. And here we go. So at-home testing overview. So why are we continuing to test? We want to keep parents, staff, and students safe. And elementary children will still be the largest group of unvaccinated students until the fall at least. And so there's still vaccine resistance and some misinformation out there. And unfortunately, the unvaccinated are able to transmit at school and back into the community. And we are also learning that even vaccinated individuals can also still transmit COVID with the new Delta variant. And especially in the fall and the winter, there's going to be a lot of overlap of the symptoms of COVID, the flu, and just common colds. So it would be good to know if your student or if a staff member is having a runny nose, if it's COVID or something else. And as we said before, the Delta variant is rapidly spreading, and so it's very important to keep testing. So what is at-home testing? So as Nancy mentioned, you guys had done testing at school in the spring, and this is very similar to the test that was done at school. So students can be tested at home before they get on public transportation or before they even arrive to school. And the best part is the results are ready in 15 minutes. And so what do I need to get started? So you just need two things, which are the test kits, which are going to be distributed by your school. And I can show you one here. It's just a very small box like this, and we'll show you a picture as well. And then a smartphone or a tablet, something that's able to scan a QR code, which we will go over. So what are the at-home test kits? So I showed you the box, and I have one with me, and it comes with two swabs like this. So it's kind of like a Q-tip. If you've ever cleaned your ears, it's like that. And then two test cards. So you can run two tests. And then you just need a small solution to run the test, and it comes in these little holders, and it has a couple of drops in it. And then it also comes with very detailed instructions of how to run the test. And then we can also do a follow-up webinar of how to run the test as well. And then primary health. We will let Laura describe what is primary health.
Thank you so much, Jackie, and thank you everyone for having us today. So I am an account manager at Primary.health. So what's Primary.health is a software platform that is enabling COVID testing, and it's simplifying the process to be able to log in test results and report to the California Department of Public Health or the different tests that are happening either at school and now also at home. I believe most of you are familiarized with Primary.health, our platform. So I'm not going to spend too much time on this. If you want to go ahead and move on to the next slide. We funded our organization in March 2020 as a result of the pandemic. And since then, we've been supporting schools and other type of organizations with testing. Go ahead and move on to the next slide. So in terms of using Primary.health for the at-home testing, so the process will be very similar to what you have done at school. What will happen is that you will be deciding internally how to distribute this kits that Jackie just showed to you, those boxes with those two tests. So it's up to you how you distribute it among your parents. And once that's done, you will be able to send a registration link to your parents through your most common channel of communication with your parents, any of the platforms that you use. And then the parents will be able to use that link to run the test at home and log the test results at home. So just so you know, the participant registration that includes information that, such as contact information and other additional information per local mandates like demographics. Now also we're asking for ethnicity, race, sex. So those are questions that are required by federal law, but also some of them are required by the California Department of Public Health. So that's just something for you to be aware that those questions are required to be answered. Also includes a digital consent form. This is in case a participant has not yet been consented or is not yet in the system. And I'm just going to pause here for a minute because I know consents can create a little bit of concern for schools. So basically, if you want to roll out the at-home testing to the students who you have already in your Primary.health account, who have already signed a consent, they are not required to sign a consent again. But if it's somebody new that is now getting started in testing, they will be required to sign the consent. And I'm mentioning this because I know that a lot of the schools are not only limiting the at-home testing to the students, but also they're expanding to their community. So they want to allow parents and grandparents and family members that are close to the students to also get tested as a way of supporting the safety of the community. So that's why if they have not been registered, we will enable a community registration in your test group to do that. Location and time for testing appointment, any symptoms, and sometimes there's additional survey questions. Right now, CDPH is requiring to ask vaccination status. It's not required, but you will be asking that question in that sort of registration flow. This is probably a lot of information, and we can have, as Jackie mentioned, we can have a more in detail webinar where we can walk you guys through the actual process, but it just gives you a sense of some of the elements that happen at the at-home testing level. So you can just move on to the next slide. So here, this is just wanted to show you a little bit of how that experience looks like for the at-home testing. So when we designed the at-home testing experience, we thought more as something that people will be doing more on their smartphones or a tablet rather than desktop. That doesn't mean they can do it at a desktop level as well. But the experience is usually to make it easier for parents to just, do quickly the testing. So once they receive that registration link and they go through just a quick few steps, they will land into this page that says self-administered test. They will enter the month, date, and year of the participant that they will be testing. In this case, it could be the child or the parent. And then the way to log in is they will have to enter the date of birth and then click on continue. Then we'll land in this page where they will have to scan the Abbott Banax Now card. And then they'll have this kind of like a 15-minute feature that could help them count those 15 minutes that is required. And go ahead to move on to the next slide. No, it's the other, yeah. And then they land in this other page where they will select the test result. It's either negative, positive, or known. So if they click negative, they will be required to take a photo of the test result as a confirmation. They will save that, and then they will be taken to a page where they will have a little bit more information about what the test result means, what it means to be negative. And if, for example, if we have a family with several children, they could, there is going to be a button at the bottom here that they can just go ahead and get another test going. So that's kind of like a very high level what the process would look like. Very similar to what you guys are doing already at the home setting, but it will be done at home. So I'm just gonna pass it to you back, Jackie, I think.
Okay. Thank you, Laura.
Sure.
And then we do have resources and teaching materials to show you how to use the test and how to use Primary Health. We'll have one-pagers that kind of list each step in very easy to follow instructions. There are also instructions included in the box, but it's a lot of wording, so we're going to try to simplify it as much as possible. And then we have also Abbott, who creates these tests. They also have videos that show you how to do the test at home. And our goal is to keep schools open as safely as possible. And that's why we're so happy to share this resource with you all and with your students. And if you guys have any questions or need any more information, this is our contact info. And if there are any questions right now, we're more than happy to answer them as well.
Mom has a question. My daughter was in here during summer school and they did a test. So when they're gonna catch the bus, do I need to do the test before she gets in the bus? I need to do it at home? Or how does that work?
So the timing of when your student does the test will be up to the school. So I'm not sure if Nancy is able to answer when CSDR will be doing the at-home test.
Okay, thank you.
Hold on 1 second. I'm telling Nancy she wasn't spotlighted, so I didn't see her talking all this time. Okay, so thank you for your question. Parents are expected to have their children take the test before they get on the bus or before the parent drives the child to the school. It makes more sense if you do the test prior. The preference would be maybe a cadence of Mondays and Wednesdays, right? Give that 36-hour window of time in between tests so that we can have more accurate results and keep track of what's going on.
So the students have to take the test twice a week.
Yes.
And then I'm also going to share in the chat, if everyone should be able to see the chat, right? It's a YouTube link and you can see what the at-home testing will look like for you and your child. And I also wanted to say that the swab, I know we've all heard about the COVID test and some of the swabs can go very deeply. And this one is not that swab. We like to call it the brain swab, those deep ones, but this one is just in your nose, just so that the cotton part is hidden in your nose, so it doesn't go deep at all. And we'll have a Spanish version to share soon as well.
Great, thank you. 2 questions. When will the test be distributed? As soon as possible. Our infirmary is going to send out an email to notify everyone of how to get the kits. So that was one thing. Second thing, when we receive them, you'll pick them up at the front. So we're right in front of the Brill building. We'll have a specific time and date for when parents can come and do that. We'll give you about a month's worth of test kits so they can last you an entire month. So you'll pick up a month at a time.
Mommy, is that school here?
So when my daughter first had the test, I already filled out all the information online. So I don't have to do it again, is that correct?
Okay, yeah, if may I add to that? So thank you for your question. So what will happen is the school will send you the link. And when you click on that link, you will see the first page of the registration flow. And you will need to enter just the first part of it, which is first name, last name, date of birth, phone number, email, and address. Once you enter that and click next, you will be prompted to another window, and that will trigger a link to be sent to your email and or your cell phone number. You will use that link to plug the date of birth and be able to enter the test results. So it will look like if you would have to register your child again, but that's only to a security way to make sure that you will be logging the test results to the actual your kid's profile. And I'm happy to kind of walk you through in a screen if this is something that you guys would like me to show you. I can walk you through and do a quick demo of how that would look like.
Okay, thank you.
So there's a question regarding tomorrow. Will they go to school without taking the test? Tomorrow's our first day of school. And yes, we do have a schedule for the testing. And I will make sure that our nurses send out an email. We do have two options. You can take it at school, or you can take the take-home test. And we'll distribute those as soon as possible. But it doesn't mean that you have to wait to get the test before your child comes back to school. You can send them back, and we do have time slots. So I gotta review that information. Right now, as it currently stands, it looks like, hold on one second. Okay, I have to look at the schedule, but again, the point is you will receive an email with the exact time slot. And make sure you complete the consent form. The consent form that the infirmary sent out. That is critical. Once your name is in the system, it's that much more convenient to conduct the test. Any further questions? Okay, I'd like to thank all of you. I'd like to thank the families for your willingness to participate in this webinar. This information is important. We are in this together, right? So just a reminder there, the more information we have, we will share as time goes on. Right now, I think we're, wanting to put children's safety at the utmost importance for everyone on campus for that matter. So thank you to Jackie and Laura. Thank you for being here.
And we're happy.
Mom had another concern. Sí, dígame, señora. My daughter has a lot of other health issues, and that's my concern. She did have COVID last year. She didn't have severe symptoms, but she had it. And I am concerned because the first day of school is tomorrow. And we don't know yet when the testing is going to be, and there's going to be a lot more students, not like summer school when there was less students. So yeah, I'm just kind of worried of how all of that is going to be handled.
I get that. I would suggest reaching out to, I'm sorry, how old is your daughter, if I could ask? She elementary, middle school, or high school?
She's She's 15. But the doctors don't want her to get vaccinated because of all the other health issues she has. They want to make sure that, you know, nothing's going to happen if she does get vaccinated.
Right, understood, totally. So that's a high school principal. I think most importantly, reach out to them, the high school principal, share those concerns. We'll work together to make sure the back to school transition is as, comfortable as possible. And again, I have to stress, we really do practice 100% mask wearing at all times. They are required here.
Okay, great. Thank you.
Sure. You're welcome.
And I just wanted to add, once you all receive your test kits, we are more than happy to do another webinar and we can practice using the kits together as well as using the app for uploading the results.
Yeah, that would be great. Thank you. Okay, Erica is asking. Yes, this information will be shared on our school social media account so that it will be accessible for everyone. All right, well, thank you. Have a nice evening.